Hey, this is Dr. Bisanga, founder of BHR Clinic. Just want to give a small talk about what really a patient need to know when they approach a clinic. Here at BHR, we have a team of advisors that speak different languages, so we can cater to all of the patients worldwide. And it's important to know that this advisor play a vital role in being the face of the clinic. They will be the first one to get in touch or to advise on what is possible and what is not possible. So it's important that an advisor has been in your shoes, or most of them had had a procedure either with me or are waiting for a procedure. But important is they understand the philosophy, the psychology, the pain, the emotion that's taking place when someone is going through hair loss and trying to find a suitable doctor or suitable clinic. One of our patient advisor, Ian, put together a document outlining the role of an advisor, and especially here at BHR, our protocol. So it's good to hear, it's good to know that they are there as the face of the clinic, but at the end of the day, I am the doctor, we are the doctor, we have a team of doctors in different locations at BHR. We eventually will make the decision of what can be done and what cannot be done. Reason why we like to conduct personal consultation ourselves, so every patient that will be operated will be seen by a doctor, not by a salesperson or a non-medical person. So it's important not to be sold a fairy tale. Hair transplant is a serious surgery. It can have a serious impact on your look, and it can take an emotional toll if things are not done properly. So here, a small presentation put together by Ian. He's going to introduce himself and explain what he does, and he's a good advisor, and he's in charge of all the English-speaking patients who contact our clinic in BHR Clinic, Athens, Greece. So Ian is British, living in Spain, and he's going to explain to you, he's going to introduce himself and explain to you the role of advisor at BHR. Thank you very much.
Please don't underestimate the value of an advisor who genuinely cares about his patients. The relationship with your patient advisor can greatly influence your overall experience. My name's Ian, I'm a patient advisor for BHR Clinic, and I'd like to share with you the following presentation regarding the role and responsibility of a patient advisor, a brief guide. So, who and what is a patient advisor? Well, a patient advisor is generally your first point of contact when you connect with the clinic. And generally, the patient will rely on the advisor throughout the entire process. So therefore, the element of trust and growing in confidence is essential within that relationship, amongst many other attributes. The patient. Every single patient presents a unique set of circumstances. They're unique in terms of their own personality, their backstory, their objectives and concerns, and obviously also the characteristics that they bring within their hair. So understanding the patient is essential, and whilst every patient will be very different, some may be very relaxed and others very anxious, so it's important to understand their objectives and make sure they're realistic. Education. Education is fundamental. It's the most important responsibility of the patient advisor to ensure that individuals are sufficiently educated. Individuals who reach out to the clinic may or may not have prior knowledge of hair restoration surgery, so it's the responsibility of the advisor to detail all of these aspects. They need to thoroughly explain the entire process and explain any limitations that the patient may have, both current and in the long term. Support. Support is key. As we already mentioned, every patient presents a unique personality. Undergoing a hair transplant can be a very stressful time for many individuals, with feelings such as anxiety and nerves, feeling overwhelmed and insecure. It's a great thing to be able to relate to the patient and therefore be better equipped to provide the support. It may be the patient's first time that they undertake this journey, and naturally they're going to have many questions. Follow-up. I personally feel that the follow-up often has a lack of importance with many clinics, when realistically this is where the patient often needs you the most. The relationship with the advisor and the clinic continues to develop through consistent correspondence throughout the healing and growth phases. For many patients, the most challenging part of the whole process can be the first few months post-surgery, so it's essential to follow up and support your patient through until their very final result.